Is your neck pain causing dizziness or a feeling of unease? Maybe like you're walking on a boat and you feel like I'm just not super steady. And I'm wondering if this is just from my neck or if there's something else going on. I've heard about BPPV and I'm wondering if I'm struggling with that. And what can I do about this problem? Then today's video is for you. Today we're going to be discussing if neck pain is causing your dizziness and how you can tell, how it's different than true BPPV, and more importantly, what you can do about it if your neck pain is causing dizziness. Ready? Here we go. First, is your neck pain what is the cause of your dizziness? If you do have neck pain that's causing dizziness, you're going to have other signs, okay? So you're going to have pain at the base of your neck. You may have a sensation of fullness in your sinuses in the front or even around your eyes. And you may also be struggling with a light headache that wraps around and comes behind that eye as well. Sometimes people will feel a headband type pain. Think like 80s headband type pain around here that can really be causing some problems and making them have those headaches. The important thing is that if neck pain is what's causing your dizziness, you are going to have some symptoms of neck pain, and usually the neck pain will precede the dizziness. So you'll have the neck pain for a couple days and then all of a sudden notice that you're also dizzy. Or maybe not dizzy, like spinning dizzy, but dizzy, feel like I'm on a boat and I can't quite find my balance. If that sounds like you, then it probably is your neck pain that's causing your dizziness. Now, you may have heard of BPPV and you're wondering if that's what you're struggling with. True BPPV is when there's a change in the inner ear canal, and what actually causes that is more of a pressure change as opposed to anything moving in or out of position or anything like that. But basically, the nerves from your inner ear are telling your brain something different than your eyes are, and your brain's confused about the whole thing. That's what's causing BPPV. So you may have heard of repositioning techniques that you've tried, but found that you didn't have any benefit from those. If that's the case, then probably it's not true BPPV. However, I will tell you that I have seen patients who had true BPPV and also increased neck tension. So it's more which one started first. If your neck pain or tension started first and then you started to feel dizzy, then that's probably what's causing that dizziness. However, if you started to feel dizzy and then you really clenched up your neck because you don't want to move your head because it causes a dizziness, then it's probably that you do have a true BPPV and that's actually what's causing your neck tension. So you deal with the BPPV and then you will not have the neck tension anymore. I hope that makes sense for you, but if you have any questions, definitely drop them in the comments below. Now, with true BPPV, you will usually notice that you'll have symptoms when you look up and when you look down. If you're suffering with a dizziness when you look up, most likely it is BPPV. And we know this because this decreases tension on the neck muscles in general. So when we look up, it decreases the tension on the neck muscles. And if you have a neck tension that's causing dizziness, this will actually help things feel a little bit better because it decreases the tension, will decrease the dizziness. So if you look up and you notice that you have more dizziness, that's probably more an inner ear or inner canal issue. That sounds more like BPPV. Now, we often see this neck pain that leads to dizziness in people who are sedentary with their jobs, which may be like an office worker who's at a computer for a prolonged period of time, and over time everything just starts sinking forward. But it could be anybody who's doing anything for a prolonged period of time. If you are sewing or knitting, working with your hands, even cooking sometimes can do it if you cook for long periods of time. Because your neck is being maintained in one specific position. So this can cause a lot of neck tension. It can cause those muscles to have to work too hard. And then what happens is that the nerves that are there that affect all of the face, so they affect the inner ear, the eye, all of those, they're called the cranial nerves. They actually do all the smiles and all of those wonderful things, but they can actually get compressed either because your chin is forward or down for a prolonged period of time. When they get tension on them, they start sending off signals, and one of them can be a signal of dizziness. So if you tend to be in a stationary position for a long period of time, it could be that neck tension that's causing your dizziness. And if this came on very suddenly, I encourage you to think about, in the past day or two, have you been more sedentary than normal or been in one position for a prolonged period of time? I have had patients come in who we were working with them on their neck pain. They started to have some dizziness as well. And I asked them, what have you done in the past couple of days? And usually there's something that was different. They were working on a project on the computer. They were getting ready for a party and preparing a bunch of food. But something that was different with what they would normally do with their neck that increased that neck tension that was already there, and that's what brought on the dizziness. All right, so if you've determined that neck tension is what's causing your dizziness, I want to give you some exercises that you can do right now at home that will help to make things feel better. The first one we want to do is a chin tuck. What this is going to do is help activate these muscles in the front of your neck, which tend to get weak when we're in this position or this position for a long period of time. So it helps to get these muscles activated again, as well as stretching out the muscles in the back of the neck. So when you're doing this chin tuck, some people recommend pushing your head back. I don't really like that. What I like to think about is tucking your chin down towards your chest just a little bit, small motion, and lengthening the back of your neck. So it should feel like there's this rotation that's happening when you're doing the chin tuck, very slight motion, as opposed to a shifting that happens with the chin tuck. That tends to not feel as good for patients. So think about it as a rotation. My chin's coming back and down, my forehead's coming up and forward. That's the motion that we want to be reproducing with this chin tuck. Now, these muscles are very, very small. So for the chin tuck, I only want you to do 10 reps, but you can do them every couple of hours. It should help to kind of help bring that head back on top of the spine, which makes the muscles in your upper neck and shoulders not have to work so hard to hold your head in place. The next thing we want to do is really get some of those bigger muscles around the shoulder activated. Getting those muscles activated can really help to decrease neck tension because a lot of the muscles that start at the upper neck attach onto the shoulder. And sometimes it's just easier to move the shoulders than it is to move the neck when it's feeling really tight. And especially if you're having dizziness and you feel like, I don't really want to move my head a lot because it's causing problems. So what I recommend you start with is called scapular retractions. So you're going to squeeze your shoulders together as if you're trying to pinch your shoulder blades together and then just let it go and relax. So squeezing those shoulders together and pinching and relax. If you find it hard to do this, you can use your elbows to help drive that motion back there. But remember, it's not just about the elbows moving, because if just the elbows move, you see that shoulder comes forward. That's not the goal. The goal is that the shoulders come back and squeeze together back behind you. So you can use the elbows if you need to. Just remember, we're not trying to get that shoulder to come forward. We're trying to get that shoulder to come back. Now this will feel really good and really help to get those muscles around the shoulder, which also attach that upper neck, moving really well. This one, since it's bigger muscles, you can do 20 reps every couple of hours. Now, if you find that trying to do any active motion with your neck flares up your symptoms and you start getting really, really dizzy, then I definitely recommend this exercise for you. It's called cervical isometrics. So what you're going to do is you're going to use your hand to provide a light pressure. Now I'm going to try to turn my head to the right side and back and relax. Compress, turn, and back. Now it's not a heavy pressure. I'm not trying to put a lot of weight onto my hand. I'm just trying to match the resistance until I feel the muscles in my neck firing. With this one, you want to do both sides because you want to make sure you're getting both sides moving really, really well. And when I'm doing a rotation, you'll notice my eyes go first and then my head, because we want to get that coordination of eyes and head. When we're feeling dizzy, that's part of the problem, is that there's this discoordination in between the eyes and the inner ear and the head and neck, and the brain's just confused about what's going on. So a very light resistance with your hand, eyes go first, you turn and look as if you're gonna look over your shoulder, so that's rotation is looking over your shoulder, but you're providing a light resistance. I like to only hold a cervical isometric for about 2 to 3 seconds, not a long period of time, and do 10 reps on each side. So light pressure, eyes go first, turn, hold, 2, 3, relax. Light pressure, eyes go first, turn, hold, 2, 3, relax. Then you're gonna do 10 reps total on that side. Make sure that you do both sides. Even if you only notice that one side feels really tight and the other side you're like, yeah, I don't really feel like I get anything out of that. It's all right. It's still going to get those muscles working. It's going to help to improve the blood flow, which is going to help you feel better quicker. Now, if you start to notice that you're feeling less tension, those muscles feel like they're moving better, and you're ready to try some gentle stretching, then this one's for you. If you feel like it's still provoking for you to move your head either side to side or turn and look over your shoulder, then don't do these yet. Make sure that your symptoms have decreased before you move on to these exercises. Even though they're stretches, they can still be a little bit aggressive if the neck really feels tight or painful. So just do what feels comfortable to your body. The first stretch I'm going to have you start with is the upper trap stretch. So we're stretching through these big upper traps. If you've ever seen any weightlifters, you can see the upper wings here. That's what we're going to do. We're going to sit and stack the head on top of the spine. We're going to bring the ear down towards the shoulder just until we get a nice light stretch through here. Now this stretch you can hold for 10 seconds before you come up. Make sure again that you do both sides. Anytime we're having any dizziness or upper neck tension, we always want to make sure that we're stretching both sides. Even if you feel like there's way more stretch on one side than the other, it's still important to do both of them. The next stretch we're going to do is for the levator scapula. So that is a muscle that attaches right at the base of our skull and then attaches at the angle of the scapula or the shoulder blade. So it really crosses a lot of area in there. And what you're going to do for that one is you're going to turn and look down as if you're trying to look underneath your armpit, and you're going to hold that for 10 seconds and come back up. Again, this one you're going to do on both sides, holding for 10 seconds. And come back up. Make sure you do 3 sets of 10-second holds for this one, and make sure you do both sides, because decreasing the tension will be really, really helpful, especially if you're dealing with dizziness. All right, if you're suffering with cervical tension that's causing your dizziness, these exercises should definitely help you feel better in at least a week. Within a week, you should definitely start to notice that your symptoms are decreasing and you're on the road to recovery. You're feeling better. You don't feel like you're walking on a boat all the time. You may still notice a little bit of symptoms if you do some quick movements, like if you turn and look over your shoulder real quick or look up real quick or down. Those quick motions can take a little bit longer to come back, but within a week of doing these stretches or exercises, you should definitely notice that your symptoms are decreased overall. If they're not, then I highly encourage you to find a manual physical therapist who can help figure out what the real root cause of this problem is and eliminate it for good. Because remember, every tissue in your body is designed to heal itself as long as it's moving correctly. If this video was helpful, please click that like button below. And if you have any comments, please add them down below. Have a great day, everyone.